Log roll the patient onto one side. While one caregiver supports the patient, the other places 2 slide sheets from head to toe. The patient should be laying on top of 2 slide sheets, with no part of the body touching the linen or mattress. To pull the patient up in the bed, both caregivers move to the head of the patient. Gripping the top slide sheet near the patient's shoulders, the caregivers count to 3 and lean back with their body weight to pull the patient up in the bed. Trendelenburg may also be used to assist. One caregiver stays at the patient's head, while the other slowly tilts the head of the bed down. Always place a pillow on the headboard to prevent the patient's head from making direct contact. Once the patient begins to slide, reverse Trendelenburg until the bed is level. To turn the patient, place the pillow in the direction of the turn, cross the patient's arms over his chest, and bend the knee opposite the direction of the turn. While one caregiver supports the patient's bent knee and crossed arms, the other pulls back on the top slide sheet, turning the patient onto his side and keeping him centered in the bed. To remove the slide sheet and keep the patient on his side, both slide sheets are tucked under and away from the patient's face, pushing toward the patient's back. Once tucked, the top slide sheet is handed over the patient and held with light tension. The bottom slide sheet is removed from the patient's feet toward the head, gently pulling under and away from the skin. The remaining slide sheet is then pulled from the feet up, under and away from the patient's skin. When the task is complete, stow the slide sheets. Remember, when using smart slide sheets, never leave under an unattended patient. Never leave on an unattended chair or bed. Never place on the floor. Stow slide sheets safely when not in use.